Welcome to The Secrets of Success. By following the proven techniques of the guests who appear on this series, you'll learn that even successful people run into detours and failures, and how you can apply their success techniques to change your life.
You're now listening to the most unique show on radio, the show dedicated to making you a success. Dr. Lara Goitein is going to give you information she hopes you'll never use. Dr. Lara, thanks for being with us today.
Thank you so much. It's a pleasure to be here.
Dr. Lara, tell us a little bit about your background to start off with.
Sure. I'm a pulmonary and critical care physician, which means I specialize in diseases of the lung and in ICU medicine. And there's a lot of overlap between those two, which is why they often go together. And I have practiced in ICUs for about 12 years, although a few years ago, I transitioned to mostly pulmonary work, treating patients with lung disease, and administrative work, running a quality program. But particularly when COVID came up, I really wanted to use my experience in the ICU to try to help the family members of people who are in the ICU, because it's a very difficult and important time for families.
And of course, for our audience, I started saying that you're going to give us information you never want us to use. Your book is called The ICU Guide for Families. Is that correct?
That's right. The ICU Guide for Families, Understanding Intensive Care and How You Can Support Your Loved One.
And ICU, for our audience, stands for?
Intensive Care Unit.
So it's kind of important if it's intensive, right?
Yes, that's right. And the intensive care unit is really a place for anyone who needs more intensive treatment or monitoring than can be provided on a regular hospital floor.
Now, when I think of intensive care, and again, just a layman, I mentioned to you before the show, I think of someone who might have had a heart attack, been in something severe, a severe accident or an explosion or something, or perhaps a stroke. Am I in the right direction? And or what are some of the other cases that you would see or would kind of bring people into intensive care? You're
absolutely correct. There are many things that can bring a patient to intensive care. Very frequently, there are respiratory illnesses, such as a severe pneumonia, asthma, congestive heart failure, cardiac diseases, in addition to congestive heart failure, heart attacks, people who have had major surgery, trauma, pancreatitis, drug overdoses. So there are many reasons that are very diverse, and what unifies them all is that need for intensive monitoring and treatment. What also unifies them is that many critical illnesses, regardless of the primary cause, manifest a few common secondary sequelae, which really come to dominate their ICU stay. So, for example, many critical illnesses can lead to something called ARDS, or acute respiratory distress syndrome. And a lot of people have heard about this in the context of COVID. It's really a pattern of widespread injury and inflammation in the lungs that can come from many sources, even infections that are far distant from the lung, for example, or severe trauma. So that's one example of a common manifestation of many critical illnesses. And these come to really dominate care.
If we have a situation where we need assistance, is it better to call 911, an ambulance, or the fire department?
Well, that depends on the situation that you're in. Obviously, if you have a cold, that's not right. Appropriate. But if you have, something that appears to be life-threatening or very severe, certainly, very severe shortness of breath or chest pain, or maybe weakness or inability to speak that might portend a stroke, then, time is really of the essence, and calling 911 is the right thing to do, to ask for an ambulance.
And getting over to the hospital, do we, and I'm talking about we as the other person, for instance, a husband and wife or a parent and a husband or child, Is it necessary to know their medications, or is it really take the emergency route, get them over there, and you can always go back and get the other information?
So that is a really important thing that families can do to help the ICU team collect the information they need, and that is to have an accurate medication list. It has a lot of importance for understanding the patient's physiology, what's on board, and what they need. So that is important. If the ambulance comes to take the patient, you will be able to travel over there separately, and you will feel like you're in a big rush, but the ambulance and the hospital staff will be taking care of the immediate needs of the patient. So if you can take time there's no need to make a list, just grab all the medication bottles, throw them in a bag, and take them with you. That will be very helpful. Of course, you will have time later to go home and get this, and it's not the most urgent priority. But if you think of it, that's a great thing to do. And if you're somebody very interested in preparation, you can have a current running medication list ready beforehand, which helps a lot.
Now, we see hospital TV shows today, and almost all of them have at least a few episodes where the big company comes in and buys up the local hospital that used to handle the local cases, and now they're part of a nationwide operation. When we get into the hospital, are we going to be hit with certain papers asked to sign, and what are our options and our rights in regard to that?
There is a lot of paperwork, and a lot of it is required paperwork that the hospital views as steps they need to get through sometimes. And sometimes you may end up signing things that are not actually well done. For example, you'll be asked to sign something that says you've been informed about HIPAA policies. And that's an acronym which I can't remember right now, but it refers to protection of patient privacy rights. This will not be your priority at the moment. I suggest you just sign the form. But when you do have some downtime, I do think it's good to read that policy so that you understand it. And then, of course, there's the issue of consent. A lot of times, patients early in an ICU admission will require a few procedures, which are very routine to the ICU team, but which you may not understand. And you'll be asked to give consent for those procedures. And I think that the process of consent is important. And I do focus in my book about how to give appropriate consent. You are not in a position, frankly, most people are not in a position to judge the relative costs and risks of procedures. But you are in a position to prompt a real discussion and reflection on the part of a busy doctor. And there are certain questions and steps that I advise you to do during the process of consent. If you'd like, if we have time, perhaps later we could discuss a few of the very early procedures that happen, most of which have to happen very quickly, and which I don't think need a lot of time for discussion.
You make a good point. One of the things you mentioned in your book, the ICU Guide for Families, and I think this is great, perhaps bring a little notebook and just jot these things down, whether it's the doctor's name, because at least I found when there's an emergency, my mind kind of gets into a fog. I'm thinking, what's the worst thing that happened? Did I run out of the house? Did I leave children or the dog there? What did I do? And now I'm getting new names, emergency treatments, medical terms that I can't spell and I don't know what they mean. So I'm thinking that probably a notebook would be the most helpful, at least as a starting point, or to tape the interview with the doctor or the administrator so I can replay what they said or what they told me. Does that make sense?
Absolutely. The ICU is, for most people, is an incredibly alien and intimidating world. There's a lot of new technology, terminology, and a lot of people, a huge team of caretakers, and you'll be getting a lot of information. Likely you will be in shock. You are probably sleep deprived and exhausted, and your memory will not be as good as it usually is. So having either a notebook, or if you prefer to do it digitally, having some way to keep notes, keep track of people's names, keep track of who told you what, I think is very, very useful.
Dr. Goitein, at this point in the show, we want to remind our listeners that you're listening to The Secrets of Success on the voice of Nassau Community College, 90.3 WHPC. I'm your host, Bill Horan. Our guest today is Dr. Lara Goitein. She's the author of the ICU Guide for Families, and this is definitely a book we all want to have nearby and be ready for, because we're going to come across an emergency, whether with our family or a neighbor, and this really sets us up for preparation. Dr. Goitein, we're going to ask you where we can get the book and if there's a website where we can find out more information.
Absolutely. So the publisher of the book is Rowman and Littlefield, and the book is available from their website, also from many independent booksellers. It is available through Amazon online and on my website, which is www.medicalexplainer.com. There's a link to purchase the book.
And to our audience, we'll give you all that information as we always do, at least 2 more times during the show. If you didn't get it down, please do, because this really can save a life. And as we kidded about at the beginning, this is the book we hope you never need. But when you do, you'll be very glad you had it, that you can mention a few ideas to a friend or a neighbor and maybe save a life or make their stay in the ICU and in the hospital a lot more successful. Dr. Goitein, when we get into the hospital, there's so many people that we run across. And as I was kidding you before the show, years ago, we used to look for a middle-aged man who looked like Dr. Marcus Welby, and we knew that was the doctor, and he would tell us. Today, most of the doctors are certainly much younger than me. They look like my daughter. I don't know if that's a doctor, a nurse practitioner, an attending, a resident, a fellow, a medical student, or a physical assistant. So can you kind of guide us who to look for when we get in there?
Sure. ICU care has become so complex that it really requires a large multidisciplinary team to take care of an ICU patient. And the good news about that is you have a lot of people thinking about your loved one, and you have very specialized expertise working on your loved one. The downside is that it can sometimes feel like no one person is in charge, and communication can be challenging. But you should know that there is one person who is legally and actually in charge of supervising the team, and that is the physician of record. They'll be known colloquially as the ICU doctor in most ICUs. And if you are in a teaching hospital, that will be referred to as the attending physician. So that person has responsibility for overseeing the whole team and coordinating all the care for that patient. And that is someone who you always have the right to ask to speak with, and who will be able to give you the big picture answers. I should say that in teaching hospitals, it's a little bit alarming to people to see so many young doctors taking care of them. But in teaching hospitals, residents, which are doctors who have graduated, are really given, in some teaching hospitals, quite a bit of authority and autonomy in taking care of patients. Now, this is all under the supervision of an attending physician. They talk with grown-up doctors every day, and in no other specialty are people supervised and regulated quite so long. So they already have a number of years taking care of patients under their belt, and they will really know your patient better than anyone. So they are very good sources of the details of what will be happening day to day and what the plan is. So they deserve a lot of respect, and they're a very good source of information.
So I guess the natural reaction for most of us would be, I don't want a student. I don't want him or her. I want the doctor or the person of prestige in the hospital, whatever their ranking is.
Yeah.
But yet, usually these younger people, typically by age, I guess, are really intense. They know what they're doing. They're up to date on things.
Absolutely. So the progression is medical students who are still in medical school, and then they become interns, which is the first year of residency. And then there are a few more years of residency. Those are senior residents. And then fellows who are doing subspecialty training above the resident. So it's many, many years of training. I trained at the Massachusetts General Hospital in Boston. And I can tell you that if I were acutely ill, I would want a senior resident taking care of me rather than anybody else in that institution. They're extremely competent and have been really immersed in high intensity inpatient care. Many of the attending physicians actually are spending a lot of time in either outpatient settings or in labs, and are coming in to give teaching and some supervision to the residents. But the residents really are expert in high intensity acute inpatient care, particularly the senior residents and then the fellows. So you should feel quite confident with their care. They're young, but they're good.
I've been to Mass General, and that's an amazing place and a beautiful place. But again, hopefully, being a hospital, none of us want to be there. But if you ever want to look at it from outside, it's beautiful. When we get into the hospital, and I'm talking about we as the person who's not ill or sick, but we're with a loved one or a friend that we're helping out. Are there certain questions? I know we're a short show today. We don't have the full time to go into 100 questions, but there are a few things you'd recommend us to ask or to put down in our notebook to get the ball started?
Well, again, it depends so much on the specific situation. I will say that that there are many, many ways that families can support care just by asking the right questions, which I try to outline throughout the course of a typical admission in my book. I'll speak as an example to trying to prevent the complications of immobility. So if a patient is lying very, very still for prolonged periods of time, perhaps sedated or sleeping, they can develop all kinds of complications like severe pressure sores, pneumonia, delirium, blood clots in the legs and in the lungs. Being still for too long is not good for us. And also, I should say, severe deconditioning and what's called ICU weakness. So getting patients moving is a focus of most ICUs. And in fact, some of the best ICUs actually walk patients even while they're on a mechanical ventilator. Which is quite a feat, but doable, and has very good outcomes. So as much movement as possible is a good thing. Now, this is very hard on nurses, particularly when they're incredibly busy, when they have lots of patients. During the COVID pandemic, it's been very hard because to have a patient be mobile, they have to be awake. And they also need to be taking risks in terms of falls and yanking out. So what patient family members can do is first ask the questions. What are the plans for mobility today? Is there any chance this patient is ready to get up to a chair, for example? And they can ask whether they can be of help. Could I sit here with the patient during the time that they're in the chair so that you're able to do your other work with your patients? This is one way that families can help contribute to getting their loved ones up and moving and better fast.
We have so many more questions for you, but again, I want our audience to know if you're just tuning in, you're listening to The Secrets of Success on the voice of Nassau Community College, 90.3 WHPC. I'm your host, Bill Horan. Our guest today is Dr. Lara Goitein, and that's spelled Goitein. She is a doctor. She's the author of the book, The ICU Guide for Families. And Dr. Goitein, would you tell us where we can get this book and, again, the website where we can find out some more information?
Yes, sure. Again, this book is available through the publisher, which is Rowman and Littlefield. through many independent booksellers and also through Amazon online. And my website is www.medicalexplainer.com. And the book is available through a link on that website.
And of course, we hope you'll never have to use it. But unfortunately, we know that these days are going to come. There's going to be an incident. It might be, as we read the papers today, you could be walking through a mall or doing something totally innocent. And next thing you know, you're on the way to the ICU or there's an emergency ambulance or something like that. So a lot of good tips you're getting from Dr. Goitein. What are some
Bill,
of the...
could I speak to that for
Sure.
just a minute? About 5 million people are admitted to the ICU every year. And if you do a little simple math crunching or number crunching, that means that about a third of us will have one of the 5 people closest to us admitted to the ICU over the next 5 years. So this really is something that touches almost all of us at some point in our lives. And my challenge now, part of the reason I'm here, is to try to get my book to people before they need it, because that first day or two in the ICU is so disorienting and overwhelming. And my hope is that people have it kind of ready to throw in their bag with their keys and their wallet and their toothbrush and the bag of medications when they're on the way into the ICU with their loved one.
Well, that's why I think it's so important. And, we went out of our way to deal with your agent and get you on this show because we want our audience to know about it. And we kiddingly call it the book you never want to use. But that's right. If we just buy the book and have that information handy, we can, again, save a life, make life a lot easier for someone, or certainly make this journey to and through the ICU a lot more unobtrusive and fearful for us. Are there some wrong images that we're seeing on TV, or does TV give an impression that we should be doing this or getting involved or pulling the cords just because we want to? Should we be aware of these things?
Well, I'm going that unless I had an unusual experience, there are a lot more love affairs and personal drama going on TV among the healthcare workers. But there are some of them are give you the feel for medicine, but there are certainly some misrepresentations. I think one common misrepresentation is there'll be a code call, which means a cardiopulmonary arrest that requires CPR and other interventions. And someone will thump on somebody's chest and they will spring back to life completely well and looking beautiful and have a joyful reunion with their partner or whatever. And this is really not how it usually goes. So in hospital resuscitations, pretend a very long, difficult hospital course usually. And in fact, the minority of people actually survive to hospital discharge after an in-hospital cardiac arrest. So I think having a realistic view of that is important when you're answering questions about whether your family member would want to have cardiopulmonary resuscitation. So that's kind of one important way that that viewers get a distorted view.
And you pointed that out, I know, in the book, and a lot of other good things. So this is why I'm going to urge people, even if you go through the book and scan it and hit some highlights, if you know 1 or 2 or 5 things more than you know today, you're ahead of the curve and you're going to help that loved one a lot better. And maybe if it's you instead of the loved one, you can spread the word to your family and they can be more of assistance to you. What are some, when we get in, we want to, I think most of us, help the staff, even if it's saving a few seconds, feeling that might be helpful in an emergency. What are some of the things we can do and should not do when someone is, admitted to the hospital?
Well, as I said, bringing in the medications is very helpful, and any other medical records you may have. So Unfortunately, a lot of people's first experience in the hospital is a lot of waiting in a waiting room, and that can be very frustrating and scary. I think it's important to know that the team is not ignoring you. They're working very hard, probably, to stabilize your loved one. But you can use that time. You can use that time to collect information, to call the primary care physician. Hopefully there is one, and let them know so that they are able to speak with your new ICU doctors or provide any relevant information. And if you have time or maybe someone to help you, collect things like advanced directives, old medical records, and that medication list, and maybe start taking some notes to yourself about the course of events and what you noticed leading up to this admission, so that when the ICU team is ready to talk to you, you can provide that information.
Those are great points, and I'm actually jotting them down myself here, because while you're sitting there, you think, what can I do? What can I do? But if you alert the primary care physician, they could send their notes over or say things that they've observed, or maybe a change in the person's behavior. We don't know, but something that might be helpful to the people in the ICU or in the emergency room or wherever they are at the time in the hospital, and at least start putting things down in an order rather than wait and do it stair step. If we're stuck waiting, we can, use that time productively. So I'm glad you pointed that out and alerted us to it. Dr. Goitein, once again, I'm going to ask you, and I want our audience to know that our guest today has been Dr. Lara Goitein, Goitein. The book is the ICU Guide for Families, and it's something you definitely want to have around your house. And Dr. Lara is going to tell us where we can get the book and a website where we can learn more.
Okay. The book, again, is available from the publisher, Rowman and Littlefield, or from independent booksellers, or from Amazon online, of course. And my website is www.medicalexplainer.com. And there's a link there to purchase the book.
We want to thank you for alerting us today. And again, I want to repeat it because it's so important. The book is titled The ICU, 3 letters, Guide for Families, and by our guest, Dr. Lara, Goitein. Dr. Lara, thanks so much for being with us today. Thanks for giving us all the good tips and alerting us what to do. We greatly appreciate it, and I'm sure you saved or made a few lives a lot easier.
Well, thank you so much, Bill. It's really been a pleasure to be here. It was a great conversation.
Thank you. We'd like to let our audience know that you've been listening to The Secrets of Success on the voice of Nassau Community College, 90.3 WHPC. I'm your host, Bill Horan, asking you to please join us again next week at the same time when we will continue our journey to success.